And I've been getting a lot of requests and questions in my inbox and email from healthcare providers that want to know more about this rural health transformation program and tech founders too. So I thought I'd just collate them into a group of 8 to 10 or so and do a quick video covering it so everybody can see what I say. And I'm spending all day looking at this program and trying to think, how can we help rural healthcare providers make it work? And how can we help them with the public outreach piece, which is hugely important? So that's what these questions are really going to be focusing on. How do you make change and transformation in rural health by convincing people and changing attitudes and beliefs around technology or around career choices, or even internal staff too, on how they can start implementing technology? It's not all about the patient community. So I've got my group of questions here. I've got my bears in the background because most of these questions came from Alaska, so I'm making this an Alaska focus episode, and I hope you all find it useful. So first question we have up is, how do I explain remote monitoring to an elder who doesn't use a smartphone? And I can sympathize with this one because my grandmother is 90 and she has a tremor in her left hand. So it's actually difficult for her to type on a keyboard, let alone a small screen touch device like a smartphone. So she has to use a phone which looks like it's from the early 2000s. It's a flip phone and it has big numbers which she can then push down. A lot of elders have issues with technology adoption or mobility in their hands. So when it comes to remote monitoring, I think that you need to rephrase that word, first of all, remote patient monitoring. Like, frame the technology as a tool that helps prevent something they don't want to do. So it's a tool that prevents a 400-mile flight to Anchorage, or it helps them keep on top of their medication and on top of their health. You have to really tie these things into people's real life problems to communicate them in a way which they understand. So the purchase of my grandmother's big button phone was communicated to her as, this is a phone that you can use to continue messaging and phoning your friends as you've been doing for years up to this point, even if you now have to live with the tremor in your hand. And we're not really explaining the mechanisms of that phone. We're not forcing a solution on her that she wouldn't be able to use, like a smartphone. We're getting the technology to meet her at her level, and we're explaining it to her at her level. So that's what you need to do. Another one, and this is particularly pertinent in Alaska Native villages, particularly around the Arctic, is how do we recruit people when there's no housing? So how do you get, new staff members to man the clinics if there's nowhere for them to live? And maybe they all have different expectations for housing, or they'll have different expectations for the community. So the Rural Health Transformation Program is funding housing initiatives, but also grow your own pipelines. So it's about not just thinking about outsiders, but how can you perhaps augment what you currently have to local high schoolers or people who aren't working in healthcare to get into community health aid pipelines. So what is your current pipeline to bring someone who has never considered a healthcare career into a community health aid training program? Do you have one, or do you just wait until people signify their interest and maybe apply to a position and then you carry them through? It's important to consider, what can you do about that awareness gap that people have of potential career options and what training pathways look like. So make content around that, put Tribal Health Association's website, or print stuff in the clinic saying you can become a community health ed, and really explain it to people and explain the benefits. I touched on housing support, and yeah, you can you can, well, I suppose the deadline for applying in Alaska has passed, but there are funds there to help people with housing. But more than housing, there's also looking after children. There's opportunities for spouses that need to be considered when it comes to recruiting people into different areas. Next up, how do I convince a provider to adopt new AI tools when they're already burnt out? So this is a question I got in advance of one of my webinars. And whenever we think of tech innovation, implementation, the gap really goes across two groups. So you have your internal stakeholders that are maybe set in their ways, have been in the organization for 20, 30 years, and they are reluctant to change. And then you've got the community that maybe are reluctant to adopt. So each of those has a different challenge that they're presenting you. The first, it's really about convincing them, as I said in the first point, how this could be of benefit to them and make their job or life easier, or make the organization's care provision better in a language that they understand. So communicating this internally has to be well thought through, and you have to be strategic about it. You shouldn't say to everyone, okay, we've got this grant money for a new platform. Your training is next week. Because people will feel disenfranchised about that. They'll feel like they weren't part of the process of you deciding what needed to be implemented and listening to their problems. So if you haven't done this already, start now. Tell your internal, could be unit managers, could be admin staff, providers, physicians, APPs, that you've identified some challenges in the system from communicating with them, and you want to use technology to fix those challenges. If you have some ideas, you can suggest them, or just ask them, what ideas do you have? Ensure you're not saying at this stage, we definitely have the money and we're going to spend it on this. Say, we are looking for money to solve these problems with technology. Do you have recommendations for what we should do? Now, if they come back with a dry response, you can only do so much. But you need to make this effort, I think, to engage them at some stage, preferably an early stage, so that whenever your new platform, like behavioral health platform that links everything together, comes in, for example, people want to use it because they've felt like they're part of building how it's implemented in your organization. You don't want to leave them out cold, because there's no point bringing a new high-tech solution in if nobody knows how to use it and nobody wants to use it. So if they're already burnt out, show them how it's going to reduce their burnout, I would say. And if it's not, well, maybe you need to reconsider what you're bringing in, or what their workload is. Moving on, what does a culturally appropriate tech even mean? So I got this because we did an interview with Dr. Jim Hamilton up in Soldotna, Kenai Peninsula, and he was speaking about a platform and some work he's done with Alaska Native communities in Kotzebue in the Northwest Arctic. And he's talking about how whenever you try to advance health literacy or do outreach related to public health among Native Alaskan communities, you need to be culturally appropriate. And RHC experts, we've considered this too. So we did a campaign in Colorado with the Office of eHealth Innovation to persuade people in 6 Western counties to use telehealth. So Colorado, Western Colorado, Grand Junction, Kotzebue, very different places, but for both of those channels, Dr. Hamilton and ourselves, what we did was consider what is the culture of this community. So what are their traditions, and what are their values, and what sort of communication is back to that phrase, on their level. So we need to speak the language they understand. Sometimes, particularly with Native Alaskan communities, it might be literally a language. It might mean, in the imagery of your tool or service, you're adjusting it so it represents, the tundra or ice or the Arctic Sea rather than a palm tree or a desert. Now, that's a very simple comparison, but you see a lot of vendors go in there and they have the same blanket platform for every community. And you have to remember that Alaska Native people are part of federally recognized tribes, which are sovereign and have their own culture and traditions. And just because they speak English doesn't mean that it's exactly the same as your culture and traditions. So you need to recognize that. You need to listen, most of all, talk to your contacts in the communities you're trying to reach, talk to their elders and listen and hear from them what is the best way for us to communicate to your people what this actually does and how it can help them. Then you're going to adjust the imagery, adjust the wording, maybe even adjust what it does so that it's on a level where people understand and benefit from it. So I'm coming up on time here. I'm going to do one more. Patients mistrust the government. Well, the government uses tech to track them. How do you explain that? So I think this is someone in a rural health clinic that faces some trust barriers, and it's definitely true. So in Colorado, they did that. The campaign we did before it, they did a survey, and over 50% of people who didn't have access to telehealth wouldn't want to use telehealth anyway. And they listed data privacy concerns, concerns about quality of care. I know in Colorado, at least, and probably a few other, should we say, Democrat majority states, that a lot of people in rural areas mistrust the metropole because they view it as having swerved the politics in a certain way, and that the politics and the culture of rural communities don't align with the culture of city. Colorado's a very good example. It's got this big city, Denver, that has grown in size, had a lot of people moving in from California, and it's kind of swung the politics in a certain way that rural voters, as a majority, I'm generalizing here massively, but wouldn't be for. And even see this, even in red state, blue state, it doesn't really matter, but people mistrust state Department of Health initiatives. We've seen this in Oregon as well, for example. And how do we communicate with them? So I would say when it comes to using this tech to track them, first figure out, will it? You need to get to the truth here. And then figure out if it won't, or indeed if it will, how can you communicate that in a way which placates people's fears and maybe inspires a bit of hope in them as well. So a great way to do this is through what we call trusted messengers. So rather than coming in with a Department of Health flyer and sticking that up in a doctor's office and expecting people to engage with it, you need to engage the actual doctor, the actual individual that has a trustworthy relationship with the person, that then they can hear from the doctor themselves about this. So trust is massive, community is massive, and think about which local organizations in your community, which individuals even, be that the primary care physicians, local counselors, can help you to explain to the community that this funding's coming in, it's going to solve XYZ problems, and here's some of the benefits of engaging with it, here's some of the misinterpretations that you're challenging, and here's exactly what will be stored in terms of data if you're concerned about that. So it's about being transparent, finding out what the truth is, and then engaging trusted people in the community to help you explain it. If you as a healthcare organization are trusted, that's great. but it could come down to your doctors knowing, when it comes to telehealth, for example, if they're trying to encourage their patients to get on telehealth, knowing what data is retained and actually being literate on that data policy instead of saying, oh, well, I'm not sure. Don't leave more doubt or lack of information among people, because that's the challenge here that we're trying to solve. So closing off, I think if I could overarchingly, if that's a word, respond to these questions, it's about listening, first of all. And when it comes to outreach here, it's about responding and outreaching in a way that has taken what you've heard from those people and then positioned it in a way that allays their fears, speaks in a language they understand on their level, and is positive and optimistic, and is kind of explaining how their life could be different if they're utilizing or engaging with whatever you have to offer. So hope you've enjoyed this. Look out for the next one, and feel free to reach out to us at RHT Experts if you are trying to transform your rural community's health, be that through workforce, be that through public health initiatives. And we'd love to talk to you. Have a great day.